causes of weak erection while keeping it within a reasonable length. Psychological factors. Psychological issues such as stress, anxiety, depression, and performance anxiety can lead to weak erections. These factors can interfere with the brain's ability to send the necessary signals for arousal and trigger the physiological response required for an erection. Physical health conditions. Several medical conditions can contribute to weak erections. Cardiovascular diseases, including hypertension, high blood pressure, atherosclerosis, narrowing of blood vessels, and peripheral artery disease, can impair blood flow to the penis, making it difficult to achieve or maintain an erection. Diabetes, which affects nerve function and blood flow, can also lead to erectile dysfunction, ED. Smoking and substance abuse. Smoking damages blood vessels and reduces blood flow throughout the body, including to the penis. Excessive alcohol consumption and drug abuse can also negatively impact erectile function. Medications. Certain medications may have side effects that interfere with the erectile process. Antidepressants, antihypertensives, antipsychotics, and some other drugs can contribute to erectile dysfunction. Neurological disorders. Conditions affecting the nervous system can disrupt the signals involved in the erection mechanism. Neurological disorders like multiple sclerosis, Parkinson's disease, and spinal cord injuries can all lead to weak erections. Hormonal imbalances. Testosterone, the primary male sex hormone, plays a crucial role in sexual health and function. Low testosterone levels can contribute to weak erections. Pelvic area injury or trauma. Accidents or injuries affecting the pelvic area or spinal cord can damage the nerves and blood vessels involved in achieving an erection. Lack of physical activity. Sedentary lifestyles can lead to poor blood circulation, which affects erectile function. Regular exercise can improve blood flow and overall vascular health. Poor diet. Diets high in processed foods, saturated fats, and sugar can contribute to obesity, diabetes, and cardiovascular issues, all of which are linked to weak erections. Relationship issues. Emotional or psychological problems within a relationship, lack of intimacy, or communication difficulties can impact sexual performance and contribute to weak erections. Treatment for weak erection. Lifestyle modifications. Encouraging patients to adopt a healthier lifestyle, including regular exercise, a balanced diet, and adequate sleep, can significantly improve erectile function. Psychological counseling. Addressing underlying psychological issues and providing behavioral therapy can alleviate performance anxiety and improve erections. Medication. Oral medications like sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra, can enhance blood flow to the penis, helping achieve and sustain stronger erections. These medications belong to a class known as PDE5 inhibitors. Hormone therapy. For men with low testosterone levels, testosterone replacement therapy may be beneficial in improving erectile function. Penile pumps. Vacuum erection devices create a vacuum around the penis, drawing blood into the shaft and causing an erection. They can be effective, especially for those who cannot take oral medications. Injections and suppositories. Medications like alprostadil can be directly injected into the penis or inserted as suppositories to promote erections. Surgery. In severe cases, surgical procedures such as penile implants or vascular surgery may be considered. Quitting smoking and substance abuse. Encouraging patients to stop smoking and reduce alcohol and drug consumption can improve blood flow and overall vascular health. Communication and couples therapy. Addressing relationship issues through therapy can lead to improvements in sexual health and strengthen emotional intimacy. Alternative therapies. Some men may explore alternative therapies such as acupuncture, herbal supplements, or certain exercises, but their effectiveness is not well established, and professional advice is necessary. Conclusion. Weak erection, or erectile dysfunction, ED, is a common and distressing issue that can significantly affect a man's self-esteem, intimate relationships, and overall quality of life. The condition can have multiple causes, including psychological, physical, and lifestyle-related factors. It is crucial for men experiencing weak erections to seek professional help from healthcare providers. Identifying and addressing the underlying cause is essential for effective treatment. A thorough evaluation will often involve assessing medical history, conducting physical examinations, and possibly performing specific tests. Fortunately, there are various treatment options available for weak erections, ranging from lifestyle modifications to medical interventions. Lifestyle changes such as regular exercise, a balanced diet, quitting smoking, and reducing alcohol consumption can all contribute to improving erectile function. For cases where lifestyle changes are not sufficient, medications like PDE5 inhibitors, example Viagra, Cialis, Levitra, can be prescribed to enhance blood flow to the penis and facilitate erections. In some situations, hormone therapy or surgical interventions may be recommended. In conclusion, weak erections are a treatable condition, and seeking timely and appropriate medical attention can lead to significant improvements in sexual health and overall well-being. Open communication with partners and healthcare professionals is essential to address concerns and explore the most suitable treatment options. Remember, you are not alone, and help is available for those experiencing weak erections.